Good day everyone. I am Angelo Duhay Lungsod and today I'm going to discuss to you a case report and a discussion involving the disease. The disease about pulmonary tuberculosis. First, I'm going to introduce to you our patient. He's a male, 18 years old male, presented in the emergency room with a chief complaint of 2 to 3 months cough, hemoptysis, fever, night sweats, and 15 pounds unattended weight loss. And the past history of the patient, his maternal grandmother had pulmonary tuberculosis 2 years ago. He also feels mild shortness of breath with an activity following his return from the Pacific Northwest. Upon the examination during admission, the patient shows decreased breath sounds and the coarse crackles in the right lower lung field. And also, the chest x-ray and CT scan showed diffuse reticular pattern and 4 centimeter cavitary lesion in his right lower lobe. And the laboratory result, specifically the IGRA, no, was positive. No, was positive. And the acid-fast staining sputum smear also reveals positive for microbacterium tuberculosis, and this test is for confirmation. So it is seen that the patient is confirmed for having a uh, pulmonary tuberculosis. Then the patient is treated, started the first line antibiotic for tuberculosis, drugs. No? Ginamot siya ng drugs, including ethambutol, isoniazid, and rifampin, ano. And then 4 days after admission, the patient discharged home with follow-up with the Department of Health. After 6-week incubation, the sputum culture grow Mycobacterium tuberculosis with a pan-susceptible for antibiotic profile. So, nakikita natin no, ating pasyente ay may pulmonary tuberculosis. Now, this time I'm going to discuss to you about this disease. What is pulmonary tuberculosis? What are the basic anatomy and physiology of the lungs involving the disease? And the etiology, what causes, no? What are the cause of pulmonary tuberculosis? The symptomatology, what are the signs and symptoms that we can see, what we can see if the patient is having pulmonary tuberculosis. And it is discussed, the patient suffered no, in our phenomenon. And the pathophysiology, how does the disease, no, how does the pathology of the disease, how does this pulmonary tuberculosis affects our lungs and the person, and especially the nursing management. What will be the action of a nurse, no, to treat, to prevent, and the health teaching about pulmonary tuberculosis. First, add the definition. What is tuberculosis? Tuberculosis is an infectious disease caused by tubercle bacillus or Microbacterium tuberculosis. It is usually invades the lungs. No? Specifically, this type of bacteria can affect our lungs. No? Invades the lungs. But it is not just the lungs. It also involves and sometimes go into our different organs. Like the colon, that is called extrapulmonary tuberculosis. So meron din palang tuberculosis, but this time we will discuss pulmonary tuberculosis. It is also involves this Mycobacterium tuberculosis. It will also involves and sometimes produces gross lesions, no, in our lungs and other organs and tissues. Okay, before we will discuss the pathophysiology, the symptomatology and the etiology of this disease, we will just first discuss a brief discussion about the anatomy and the physiology of the lungs. What is the lungs? What is the main work of our lungs? Well, the lungs are the fundamental organs of the respiratory system. Meaning to say, this is the most important organ, no, that is working for our respiratory system. What is the function of the lungs? The most basic function is to facilitate gas exchange, no, from the environment into the bloodstream, or the inspiration and expiration. Yung paghinga natin, the lungs is doing that. Oxygen gets transported through the alveoli, no, into the capillary network, where it can enter the arterial system, ultimately to perfuse tissue. So our lungs is responsible to perfuse oxygen into our periphery, diba? So our circulatory system, with carrying, specifically the hemoglobin carrying oxygen, will pass through the lungs, no, to carry into our tissue to oxygenate. Then the respiratory system also is composed of primarily the nose, no, our oropharynx, our larynx, our trachea, our bronchi. Now, these are the upper respiratory tract. The bronchioles and the lungs are our lower respiratory tracts. So that is composed of our respiratory system. Now, the lungs is divided, no? Specifically, the lungs is divided into individual lobes, no, which is ultimately subdivided into over 300 million alveoli. No, diba? Ang dami. So what are those alveoli? The alveoli are the primary location for our gas exchange. When we inspire oxygen and when we expire oxygen, those gases exchanges is happening, no, is happened into the alveoli. So as we can see in the picture, that's the sample of an alveoli. It's located in our lungs, and it is the functional unit of our lungs, the alveoli. Then somehow the lungs is the primary location for a large proportion of human diseases, such as our discussion for today, pulmonary tuberculosis. So, what are the symptomatology, or what are the symptoms of having a pulmonary tuberculosis? Well, it is shown by our patient, based on our phenomenon, that the patient is having a generalized systemic signs and symptoms. As I have said a while ago, Mycobacterium tuberculosis can affect not only to the lungs, but into the other organs and tissues. Well, the patient may be asymptomatic or may have insidious symptoms. Insidious symptoms are ignored. Well, the generalized systemic signs and symptoms, no? First is the fatigue, anorexia, weight loss, low-grade fever, night sweats, and indigestions. As we have seen in the picture, no, it is shown or it is manifested by our patient. Our patient is having a dry cough for 2 to 3 months. May weight loss siya. Meron din siyang hemoptysis, no? Meron din siyang hemoptysis. And yan nga, weight loss. So, ito siya, no? Generalized systemic signs and symptoms. And then, other patients may have also a acute febrile illness. So, ibig sabihin, acute. Usually, this is called a afternoon fever. Nagkakalagnat sila tuwing hapon lang. Chills and generalized influenza-like symptoms. Now, the pulmonary signs and symptoms. First, no, the first symptoms that may have seen if the patient is having pulmonary tuberculosis is cough. It is usually it is insidious onset, no? Ubo-ubo lang, progressing in frequency and producing mucoid and mucopurulent sputum. Yung sputum niya o yung plema niya makapal, no? Una, insidious, parang ubo-ubo lang. Hanggang sa magkakabuo ito ng mga plema or yung plema niya magiging makapal, no? Sticky. Minsan color niyan is color green na nga. And then hemoptysis. What is hemoptysis? Ito yung spitting or yung nagdudura na may kasaling dugo. Yung mucus na ginadura ng pasyente, minsan may kasali ng dugo. Then chest pain, no? Chest pain, na dyspnea, indicates intensive involvement. Pag may ganito na gani na mga symptoms, ibig sabihin, the patient is delikado na, no? Parang extensive na yung lesion na nangyayari sa lungs niya. So, the extrapulmonary tuberculosis, no? It is not located also in our lungs, ating lungs, no? Microbacterium can infect many organ in our body, as what I have said kanina. It can also affect into our pleura, no? The peritoneum, no? Meron din tayong tinatawag na abdominal tuberculosis, no? And we have also central nervous system. So, how this pulmonary tuberculosis transmit, ano? So, the transmission, how this pulmonary tuberculosis transmit, no? Paano siya nakakahawa? Tuberculosis nuclei is an airborne disease. Airborne disease. Transmitted by droplet or nuclei. So, when we say airborne, so ibig sabihin, pwede natin to siyang makuha sa hangin and droplets. So how can this be discussed, no? The term microbacterium is descriptive of the organism, which is a bacterium that resembles a fungus. The organism multiply slowly and are characterized by acid-fast aerobic organism which can be killed by heat, dying, and ultraviolet light. So, it is transmitted through, paano natin to matransmit? Through coughing, no? When the patient, the first patient is having a pulmonary tuberculosis, like what happened to our patient, it is not said in the phenomenon na maybe nakuha niya yung sakit niya na pulmonary tuberculosis sa lola niya. Kasi sabi, ang lola niya ay nagkaroon ng history of pulmonary tuberculosis 2 years ago. And the patient had a contact with his grandmother. Diba? So, pwede niyang nakuha doon. And sabi doon, the characteristic of this Mycobacterium tuberculosis is hinay-hinay. Dahan-dahan na nag-growth until it can affect our lungs. No? Parang ubo-ubo lang, meron na palang pulmonary tuberculosis. So that is how it is transmitted through coughing. Halimbawa, gumamit ka ng isang baso na mayroong positive pulmonary tuberculosis and it is not treated, then ginamit mo rin. Pwede. Then pakikipag-usap. One-on-one talking, di ba? Nagsasalita ka, and then kaharap mo siya, and then those droplets or nuclei of his or her saliva, pwede mong ma-acquire yung disease. Okay? Now, we will go to the diagnostic evaluation. How can this disease evaluated? Okay. First is as what have also nagawa dun sa pasyente natin, our patient also is undergone sputum smear and culture. Kung mapansin natin, nag-positive siya for Microbacterium tuberculosis, no? So, it is made by finding acid fast bacilli in the sputum, no? Obtained by coughing and expectoration to increase and inhaled aerosols. So, ang nangyayari dito, dudura yung pasyente na may suspected, especially pag may X-ray result na pwedeng may lesions sa baga niya, no, sa lungs niya. So, to confirm that the patient is really having a Microbacterium tuberculosis and positive for pulmonary tuberculosis, this procedure, diagnostic procedure will be done for confirmation. The sputum smear and culture, no? And then another, no, confirmation by the sputum. And then another one is the chest x-ray. This is to determine the presence and the extent of the disease. Tinitingnan dito sa chest x-ray kung gaano kalawak yung affected, yung apektadong lungs, no? Gaano kalawak, gaano kadami yung lesions na ginawa ng Microbacterium tuberculosis doon sa lungs, sa baga ng pasyente. This is another test also. We have tuberculin test or Mantoux test. What is this test, no? This test is a inoculation of tubercle bacillus extract into the intradermal of the patient. This is usually done to know if the patient is contacted, no, with a positive patient having Microbacterium tuberculosis. This diagnostic test or Mantoux test is done to those parang meron ka bang contact tracing, ano? Parang contact tracing ito. This is done by injecting a tuberculin test, para siyang skin test, no, for 72 hours bago makuha ang result if the patient is positive or contacted a Microbacterium tuberculosis or tuberculosis. Okay, now we're here in the pathophysiology or the pathology of the disease. How does this Microbacterium tuberculosis affect our lungs? No, take note. The etiology, what is the cause of our pulmonary tuberculosis? The bacteria Microbacterium tuberculosis. Now, how can this Microbacterium tuberculosis affect our lungs, no? And maybe other tissues? Tubercle bacilli infect the lung, forming a tubercle lesion. Tubercle lesion. So, ibig sabihin, itong Microbacterium, itong bacteria na ito, ay nagkokos ng sugat, no? Lesion, maliliit na sugat, lesion, sa ating baga. And this tubercle, no, mga spot ito sila kung tatawagin, may heal, leaving scar tissue, no? So kung may sugat or may lesion sa ating baga, ano nga? Ating baga o ang ating lungs is the primary organ for our respiratory system. Ito yung dahilan, no, kung bakit kung tayo humihinga. So paano pag may lesion? So doon na, lalabas na ang mga signs and symptoms gaya ng nahihirapan maghinga, pag-ubo, hemoptysis, no? Nagdudura na may kasamang dugo. So yun na siya, no? And then these lesions may heal, no? But it will leave a scar into the tissue of our lungs and may continue as a granuloma. So may heal, no? And hindi ibig sabihin na naayo or gumaling ang sugat. Hindi na babalik. This lesion or this scar lesion, leaving scar tissues in our lungs may be reactivated. Pwede siyang mabuhay muli. Pwedeng magkaroon ng sugat muli, no? Na magkakaroon ng maraming lung problems. And then, may eventually also proceed to necrosis. Ito yung nakakalungkot dito. When our lungs, no, when these lesions, no, will become necrosis or death, no, there will be malfunction into our lungs. So paano pag namatay yung lungs natin? No? Paano pag may part ng lungs natin nagkakaroon ng death or necrosis na this will, no, cause lung collapse or lung failure. So, mayayari, pwede itong ikamatay ng pasyente. The initial lesion may disseminate tubercle bacilli by extension to adjacent tissues, via bloodstream, via lymphatic tissue, and through bronchi. So, pwede siyang dumami, no? Pwede siyang ma-extend. Parang cancer din ba? Pwede siyang maging malignant. Okay. Let's proceed to the risk factors for activation of tuberculosis. Who are the persons at risk to acquired pulmonary tuberculosis? Number 1, adults who initial infection was acquired many years previously. This person harbor live dormant bacilli that at any time may reactivate and spread disease. So, who are these persons? Ito yung mga pwedeng mga nagtatrabaho sa hospital. Meron na silang TB na nagtatago lang sa lungs nila. Anytime, no? Especially pag tumatanda na, humihina ang immune system. Kaya nagre-reactivate, no? Nabubuhay itong mga TB na to, itong mga tuberculosis na to, itong mga bacteria na to. So those person are at risk, especially yung mga nasa ospital, mga kapamilya na may traces na merong kapamilya sila na may TB, and then time will come na posible man ibig sabihin, no, na lahat posible na pwedeng ma-acquire nila ang sakit na ito. Number 2, persons in close contact with someone who has infectious tuberculosis. Yun na nga sabi ko, no? Yung mga may close contact, kung may kapamilya kayo na may TB na untreated, especially untreated, hindi nagamot na TB, tapos you're in a close contact with that patient or with that person, pwede mong ma-acquire. You are at risk of having a pulmonary tuberculosis. Number 3, no? Person whose tuberculin skin test have recently converted to a significant reaction. Ayun nga, sabi ko kanina, yung tuberculin, no? IGRA, yung tuberculin skin test, kung positive ka niyan, anako, kailangan mong magpa-confirm, no? Kung may TB ka ba o wala, through sputum culture exam. Number 4 is persons with lower resistance because of alcoholism. So, hindi lamang yung paninigarilyo na pwedeng magkakaroon ng pulmonary tuberculosis, kundi itong mga manginginom ng alak. And especially, manginginom ka pa ng alak and you have lowered resistance. So, you're at risk of having tuberculosis. Kaya, pwede kayo, any person, no? Pwedeng magkakaroon ng pulmonary tuberculosis. Number 5, elderly. Yung mga matatanda nating mga manamahal. Sila yung most frequent na nagkakaroon ng pulmonary tuberculosis. Especially when they're living in extended care facilities who have healed dormant lesions, no? Pwede sila, lalo na. Kasi una sa lahat, mahihina na ang mga resistensya. And pwede na nagkakaroon sila ng contact, no, with the patients having pulmonary tuberculosis long time ago. So kaya, ganon. And then, number 6, patient receiving corticosteroid therapy. Patient with chronic renal failure, hemodialysis, patient with cancer, organ transplant, pwede silang magkakaroon ng pulmonary tuberculosis. Intestinal bypass surgery for obesity. So, these are the persons that are at risk, At risk. So, if you're at risk, so please, ingat-ingat tayo, and then let's do our precautions. Well, I will also discuss how can we prevent this type of disease. Now, in nursing intervention, as what I have said kanina, i-discuss din natin what are the nursing actions at the nursing diagnosis that we will prioritize. Based on the assessment data dun sa pasyente natin, the nursing diagnosis may include, dito na tayo sa ating nursing diagnosis. Number 1, I have determined 3. 3. Ito sa tingin ko, ito sa tingin natin, ito yung mga importanteng nursing diagnosis. Number 1, ineffective airway clearance related to copious tracheobronchial secretions. Diba? Pag may tuberculosis, mayroong thick mucus. So, pwede siya magkakaroon ng ineffective airway. Difficulty breathing, Hindi na siya makagawa ng mga daily activities because of that. And then, hemoptysis. Kaya magkakaroon ka talaga. May lesion ka na sa lungs. So, magkakaroon ka ng ineffective airway clearance due to yung makapal na plema. Number 2, activity intolerance related to fatigue, altered nutritional status, and fever. Especially when you have afternoon fever or chills, flu-like symptoms, so the patient cannot do ADLs or activity of daily living. So magkakaroon ng activity intolerance. Number 3, we have knowledge deficit. Ito, crucial din ito. Bakit? About the treatment regimen and preventive health measures and related and effective individual management of the therapeutic regimen. Ika nga sa ngayon, sabi nila, hindi na kinakatakutan na magkakaroon ng TB kasi may gamot. Then if you have taken those medications that is intended to this disease, after 3 weeks, hindi na siya nakakahawa. So, ganito, yung mga tao na walang kaalaman tungkol sa gamutan at paano maiwasan ang sakit na ito, this is the priority of nursing diagnosis. This is one of the priority. This kind of disease, pulmonary tuberculosis, needs education. Kung may TB ka, kailangan alam mo anong gamot, saan ka pupunta, alam mo paano maiwasan na spread ito, at paano maiwasan na hindi ma-acquire ito. And we have also the collaborative problems in our patient, like the malnutrition, the side effects of the medication therapy, kung siya ay umiinom na ng gamot, multi-drug resistance. Ito, multi-drug resistance. So, maganda din ito, And then, yun nga, ang tatlo nating nursing diagnosis. So what are our goals? The major goals for the patients may include increased knowledge about the disease and the treatment regimen, and then adherence to the medication regimen, and then absence of complication. So, kailangan ipaalam natin sa pasyente kung paano ito magamot, paano sundin ang gamutan, at kailangan tapusin ito, and iwasan ang komplikasyon gaya ng malnutrisyon at iba pa. And then, what are the nursing interventions? What should the nurse do? Administer prescribed tuberculosis drugs. So, we need to empower the patient, especially pag nasa bahay na sila, na kailangan sundin ang mga gamot na kailangan inumin sa nakalaan na mga araw or days for the treatment. And then, treatment is continued until the X-ray is clear, and until negative sputum cultures. Hindi ibig sabihin na pag umiinom ka ng gamot, habang buhay ka nang umiinom nito, ito ay i-discontinue or ipapahinto ng doktor kung ikaw ay gumaling na. Pero gagaling ka lang sa TB kung ikaw ay tumalima or you are following the treatment regimen. So, yun lang, no? Kailangan natin yan ipaalam sa pasyente. The patient may take these medications from 6 months, 9 months to 24 months. It depends. Depende yan, no? Sa gaano kalala, kailan gagaling ang kanyang sakit or pulmonary tuberculosis. So, paano natin papangaralan ng pasyente? Our health teachings. We need to educate the patient about the disease, that he must understand the importance of continuing to take medicine for the prescribed time. Kailangan tapusin, no, ang course of medication. And kailangan ipaintindi sa pasyente kung ano ang sakit na ito. Paano ito nagagamot at paano ito iwasan na ma-spread sa iba. And then, the nurse also must review the side effects of the drug therapy. Ipaalam sa pasyente anong pwede niyang mararamdaman kapag siya umiinom ng mga gamot para sa TB. Like for example, the patient may urinate a orange color of urine. Kasi isa yan sa side effect. And then, maaaring siya ay palaging nagugutom. Pwede yan. Ano? So, if those persist, no, na parang hindi na siya normal, the patient needs to report it to the doctor. And then, review the possible complications with the patient and the family, like hemorrhage, no, pleurisy, symptoms of recurrence, persistent cough, and hemoptysis. Pag ang pasyente ay dumudura na may kasamang dugo, kailangan i-review ito at dalhin agad sa kanyang doktor. And ito, importante ito, to deter the spread of microorganism, no? As we mentioned earlier, no? How can this be transmitted? Through airborne, no? Through airborne. So, it is important to educate the patient to control propagation of secretions while coughing. So, we need to teach the patient the proper etiquette of the coughing. First, cover the mouth and the nose using tissue. Hindi kamay, ha? Hindi kamay. Using tissue. Double ply tissue when coughing or sneezing. Do not sneeze. Huwag mag-sneeze sa bare hands. No? Maaring matransfer kasi ito. When you hold another things, another person hold that things, pwedeng matransfer sa kanya yung Microbacterium tuberculosis. So, kailangan may tissue. And then, yung tissue, itapon sa tamang basurahan. Pagkatapos, huwag kalimutan, maghugas ng kamay. Wash hands after coughing or sneezing. And then also, educate and encourage the patients to eat nutritious diet. Kailangan nutrisyon kasi, di ba, yung pasyente natin kanina may unexplained weight loss. So, kailangan i-boost yung immune system niya, encourage ang pasyente na kumain ng masustansyang pagkain. Umiwas sa sigarilyo, alcohol, at iba pang hindi masustansyang pagkain. And also, patients' problems with alcohol should be referred to an alcoholic clinic or appropriate health agency. And then, avoid job-related exposure to excessive amounts of silicone. Yung mga, especially, limbawa, yung mga, pag ikaw ay pasyente na may tuberculosis na nagtatrabaho, limbawa, ikaw ay painter, no? Yan, delikado yan, no? It can induce, no? Na maglala, no? Yung lesion doon sa lungs mo. Kaya, avoid job-related exposure to those, like silicone. No? And then, encourage the patient to report to clinic physician at specific intervals for bacteriology examination. Kung kailan yung follow-up check-up, pumunta. Pag ubos ng gamot, pumunta sa health center or pumunta sa doktor or sa hospital. Ang pasyente natin kanina sa phenomenon, maraming pera siguro yun. Kaya sumusunod siya, makita natin. Sumusunod ng pasyente sa treatment regimen na angkop sa kanya. Yun dapat ang gagawin ng mga pasyente na may pulmonary tuberculosis. So that would be all. And I would like to say thank you for listening to my report. Hopefully, may naiintindihan kayo. And thank you for watching. Good day, everyone.